Hello, everybody. Welcome back to the Incubator booth at NeoHeart 2024. We are here and joined by Dr. Mary Mullen, who is a pediatric cardiologist from Boston Children's Hospital. Mary, thank you so much for making the time to drop by the booth today.
Certainly, I'm delighted to be here today.
You have a very interesting talk titled Navigating Complexity. And then it gets into some cardiology things. But just the first two words, navigating complexity, is something that is so fascinating. The talk is titled Navigating Complexity, Heterotaxic, Complex CHD, and Mixed Pulmonary Vascular Disease.
And you're supposed to do it in 15 minutes.
That's right. And I'm the first in the session. Sometimes you would think that the navigating complexity comes at the very end.
I think that's such an interesting and compelling topic because the practice of neonatal care, neonatal cardiac care, has really become quite complex. There's more premature babies being born, more less mature babies being born, and the degree of cardiac complexity increases. So in a few minutes, how do we deal with complexity in neonatal?
Absolutely. So there, are a variety of aspects to navigating complexity, and I really thought deeply about that as I was preparing what I'm going to say to the conference. First of all, complexity really means changes over time. And we see that in the neonatal ICU and the cardiac ICU, that things are very fluid. There are complex developmental defects. There are issues of transitional physiology. There are complications of prematurity. And so things are complex, and they are made more complex by certain events and things that unfold in the care of a neonate. And those include things like genetic diagnoses that might not have been recognized previously, by complications of prematurity, so necrotizing enterocolitis, concomitant bronchopulmonary dysplasia and lung disease, and other issues that really might be affecting the care. And then finally, complex congenital heart disease. And we chose several aspects, particularly mixed pulmonary vascular disease, which we see more and more of. And to me, that really reflects pulmonary vascular disease, which occurs from a variety of causes. So those would include left to right shunt lesions, intrinsic pulmonary vascular disease, and left-sided lesions, such as pulmonary vein stenosis. And those are some of the challenging issues that we're dealing with more and more.
So it's interesting that this is the title of your talk. I think we had envisioned, as our technology gets better, as we're better delineating these genetic syndromes, like you mentioned, that things would get easier, but they seem like they're more complicated than ever.
Well, I think that, we certainly are taking on more challenging infants. You're exactly right. And then it really points out the way that we tease out some of these aspects. So our imaging, our echocardiography, MRI, and cardiac CT cross-sectional imaging has become better and better. And so we're really able to identify some of these issues. And then we're able to intervene in ways that we were not able to intervene before. So interventions in the cardiac cath lab, as well as hybrid procedures from a cardiac perspective. And all of those really increase the complexity, but I think also increase the survival of our patients.
What is your take on the team that is necessary to address this complexity, and both the skills and the composition of the team?
Excellent. Well, that's really the take-home message. You have to have a really superb multidisciplinary team made up both of neonatologists, cardiologists, cardiac surgeons, imagers, catheterizers, geneticists, and specialists in all of these areas who can really help to move things forward, who can identify various pitfalls, strategize together, and who work together.
It's interesting because this is something that is it's not a novel concept, right? And in other specialties in adult medicine, the internist is the orchestrator and coordinates all this. But I think in this particular case, we are trying to ask people who are usually the primary people in their specialty to now collaborate. So who do you feel that the task of coordinating the care falls onto? Is this
$1 million question?
It's $1 million question. Now, you might know that my initial training was an internist. So I have to say I love to take the role of the coordinator. And sometimes it's the pulmonary hypertension specialist, quite honestly, who can really bring all of these groups together. And it's one of the things that makes working in pulmonary hypertension so exciting, because you have all these fantastic colleagues. They're looking at a problem, issues of the pulmonary vasculature. But how do you orchestrate it? What do you treat first? How do you encourage everyone to persevere? And how do you turn over every stone until each child gets better?
wow?
And then I have one more piece of the complexity puzzle. What is our role in helping parents understand this sometimes chaotic pathway?
Yes, it's an excellent question, because sometimes there's insufficient data to even present to our families. And you really don't want to be anecdotal going from case to case. But it's really important. And it's important that we work with our families to understand where a child is at, what we think the expected outcome and expected follow through will be. And we have to be very honest and transparent in all of that.
I want to go back to this question that I asked about. So you said whoever is managing the pulmonary hypertension. And so you didn't give us really a definite answer. You didn't give us a specialty. And I think that's so interesting, because it is
Because different people can manage it.
whoever is taking this on,
Yeah.
basically.
That's right. Whoever takes on the role as really, leading this charge. And I work in an organization called the Pediatric Pulmonary Hypertension Network. And within that organization, we have neonatologists, pulmonologists, pediatric cardiologists, as well as many other subspecialties. And, they really all work together. And it's like an elephant that you see from all different areas, right? Depending on where you are. So I think it's really important, but whoever is leading the charge has to make sure that everyone is included.
And since you mentioned it, for people who are interested in learning more about pulmonary hypertension, becoming that expert in their respective institutions, how can they get engaged with this community?
Yeah, pulmonary. This particular community, PPHNet, can be found on the web, pphnet.org. They're open for membership, and there's a great role for training in pediatric pulmonary hypertension for neonatologists, for pulmonologists, for cardiologists, for geneticists, and for translational scientists to really say, this is an area we want to approach, this is where we want to move forward.
Mary, thank you so much for taking the time and
Sure.
for sharing.
Great
all
to
this.
speak with you.
Yeah, thank you so much. Have a good rest of your
Terrific.
conference.
Thank you so much.